How is a bone marrow biopsy done for T-cell lymphoma? Imagine a tiny needle going into the back of your hip to help doctors understand how your lymphoma has spread. That's what a bone marrow biopsy for T-cell lymphoma involves. It's a common test used to see if the lymphoma has reached the bone marrow, which is the soft tissue inside bones that makes blood cells. Knowing whether the disease has spread helps doctors decide on the best treatment plan. The procedure usually takes place at the back of the pelvic bone, called the posterior iliac crest. It involves two main steps. First, a bone marrow aspiration, and then a bone marrow biopsy. Before starting, the doctor will clean the skin over the area thoroughly to prevent infection. They will then inject a local anesthetic, which numbs the skin and tissues. You might feel a quick sting or burning sensation during this step, but it helps make the procedure more comfortable. Next, the doctor makes a tiny cut in the skin to insert a thin, hollow needle into the bone marrow cavity. For the aspiration, a syringe is attached to the needle, and a small amount of liquid bone marrow is gently pulled out. You might feel a sharp, brief pain or a shooting sensation during this part, even with the numbing medicine. Once enough sample is collected, the needle is carefully removed. Right after, the doctor inserts a slightly larger needle into the same spot to take a small core of solid bone marrow tissue along with a tiny piece of bone. This part might cause a feeling of pressure or a brief discomfort. After the sample is taken, the needle is removed, and pressure is applied to the site to help stop any bleeding and promote healing. Once the procedure is complete, the area is bandaged. You might experience some soreness or mild pain for a few days afterward, which can be managed with over-the-counter pain relief if needed. The collected samples are sent to a laboratory where a pathologist examines them under a microscope. They look for lymphoma cells or other abnormalities that can tell the doctor about the extent of the disease. This test is a key part of staging T-cell lymphoma because if the disease is found in the bone marrow, it indicates a more advanced stage. It helps doctors understand how aggressive the lymphoma is and guides treatment choices. The procedure is performed by trained specialists like hematologists or oncologists, who ensure your safety and comfort throughout. Remember, a bone marrow biopsy is a minimally invasive but very important diagnostic tool. It provides vital information about the spread of lymphoma, helping to shape the best possible care plan for each individual. Always discuss any concerns or questions with your healthcare team to understand what to expect and to get personalized advice.